Welcome to Quality Time with MoreSteam. I am your host, Dan Swartwout. Today, we are bringing you another great episode focused on healthcare. I had a fantastic conversation with Dr. Mary Reich Cooper and Lean Six Sigma Master Black Belt Michael Anderson from the Jefferson College of Population Health at Thomas Jefferson University. I learned a lot from this conversation. I always find it fascinating to hear how the principles of continuous improvement and Lean Six Sigma are applied in the area of healthcare. And of course, because Mary and Michael are from Philadelphia, and because I am a big football fan, there might just be a reference or two to the current Super Bowl champions. Thanks for tuning in. I appreciate you being here. And now my conversation with Mary and Michael. Today, we are lucky enough to be joined by Dr. Mary Reich Cooper and Lean Six Sigma Master Black Belt Michael Anderson from the Jefferson College of Population Health at the Thomas Jefferson University. I don't know if you use the. I'm from Ohio State, so we're usually saying the Ohio State University. So now I think I'm putting the in front of every university. But is there a the in front of Thomas Jefferson University?
We'll take it. I have no idea if they put a the there, but anytime anyone says the, I think, boy, what a great thing to think about.
And I have to say that listeners of the show know that I am a fan of gridiron American football, and both Michael and Mary from Philadelphia, home of the current Super Bowl champion Philadelphia Eagles.
That's right.
What was it like when the Eagles were up 34-0 in the Super Bowl in January?
We were still pretty excited.
Yes, exactly.
It never got ho-hum at all. And exactly. I so appreciate you weaving that into this podcast, and so does Taylor Swift. She was in Philadelphia this weekend for Mother's Day. Yes, with not her beau, but with her beau's brother and his wife, and their mom. So yes, anytime you can bring up the Eagles, we are very appreciative.
And I just wanted to make sure I saw all zeros before I celebrated. That's it. I'm sorry.
Well, there was 28-3 with the Falcons and the Patriots a few years ago.
Yes, exactly.
So you definitely wanted to wait until the final whistle. Thank you both so much for joining us on the show here today. Both very involved with Michael and Mary, both very involved in the world of operational excellence, process improvement, and Lean Six Sigma in the area of healthcare, which is something we have been talking a lot on the show about recently. Now, Mary, I'm curious, you're both a physician and you have a degree in health law. How did that unique background shape your approach to quality and patient safety?
Well, thanks for asking me that, Dan, because it's the first question out of most people's mouths. How did I end up doing this kind of operational excellence background with that background? I did practice medicine for 10 years. My kids don't always believe me, but I did practice medicine for 10 years before I moved into hospital administration. And by that time, I had my law degree as well. And when I first moved into hospital administration, I was at what's now New York Presbyterian. I was on the Cornell side when I started. And there weren't a lot of physicians at that time, and certainly not physicians with law degrees, who were in the quality and safety world. Safety was just coming into being. It wasn't until they released Eris Human in 1999 that people really started to think about safety. And so I just happened to be in the right place at the right time. In a few years after I was in the role of leading quality at MYP, we made a $4 million investment in operational excellence, and our ROI on that $4 million was 80. That's $80 million. And that just hooked me from that point on. To get that kind of ROI on any kind of activity was just remarkable. So I am all in when it comes to operational excellence.
Wow, that's 20 times ROI?
How about that? So
Wow. Michael, tell me what drew you to Lean Six Sigma and operational excellence. You're a Lean Six Sigma Master Black Belt. What drew you to Lean Six Sigma and operational excellence after your work on clinical effectiveness at Penn? Because you were at Penn before coming to Thomas Jefferson, correct?
That is correct, and that is a great question. So at Penn, I was really like knee deep in clinical effectiveness and quality improvement. And we really focused on outcomes, evidence-based care, and just making sure that we were doing the right things for patients at all times. But I kept running into the same kind of issues. Even when we knew the right thing to do, the system didn't always support that, and even the leadership at sometimes as well. And that's what pulled me towards Lean Six Sigma. And it's like, okay, we've got the science. Now, how do we build the engine that actually delivers its reliability? And of course, make sure that we're doing it every time for every patient. So operational excellence became the bridge between clinical insights and real world execution. And I've been loving it ever since.
Michael, as I was looking at your background, a word that I found was the word informatics.
Yes.
I'm not really familiar with informatics. Could you explain what that is?
Informatics is basically taking information and data and merging the two to create stories. And when you create the right story, you can tell that to the right, because leaders don't have a lot of time. You have to get to them very quickly. So you have to really take these graphics sometimes. So you take graphics and merge it with data. And that's just a simple way of saying informatics.
That is fascinating, because one of the things we've talked about on this show is you have someone like yourself who is a Lean Six Sigma Master Black Belt who can speak with great depth about complex statistical issues. How do those issues get conveyed to people who don't have that same expertise and understanding? And now you're telling me there's an actual term and a scientific approach to that.
Yes.
That's fantastic, because I'm going to go back and listen to all the old episodes and say, that's informatics, that's informatics, that's informatics.
Exactly.
Awesome.
We love telling stories, and sort of in our field, we love telling stories because it's the way to engage not only with our workforce but also with our patients. And so any time that we can convey information by telling a story and stuff, we latch onto that immediately.
Wow. We've established that you both come from different backgrounds. Mary, you with medicine and law, Michael with informatics, process improvement. I'm glad I've got a set term for that now. How have those backgrounds and those different experiences influenced the way you collaborate on Jefferson's operational excellence program?
So Dan, a few years ago, I came to Jefferson to lead their quality and safety program. And at the time, Mike's predecessors were trying to get an operational excellence curriculum established at Jefferson. They had done it in a way through the human resources training folks, but it hadn't really stuck at the academic level. And because I had a long background in operational excellence already, as soon as I saw what they were doing, I embraced it. We brought Mike in about, Mike, 2 years later, and Mike's slowly come up the chain of command in terms of leadership. It is, I think, in our college, sort of our motto that I keep using is we practice what we teach. So it is really important to me to have faculty in our college who are out there doing it in the real world. And that's what Mike does. And so when our students come to us and they want to learn about anything with healthcare delivery, and especially about operational excellence, their faculty are people who actually do this in jobs around the country. And that makes their education, that makes their learning so much more valuable to them, because Mike can tell a story about, oh, in my organization, we did this. So Mike, do you want to elaborate on that at all?
Yeah, I'll say this. It's been a blast for me, Dan, to be honest with you, because Mary brings this razor sharp clinical and legal lens, and she's thinking about patient rights, regulatory, and like human side of care, even though she understands and does quality as well. But I'm coming in with data models, workflows, and system design. It's like a jazz quartet, right? Where we just basically rotate off each other. But the diversity,
Right.
and that diversity of thought actually makes our solutions like a lot stronger. So we definitely challenge each other. but always with the shared goal of making sure that healthcare is safer, smarter, and of course, more humane as well.
You brought up something very interesting, Michael. When people initially think of process improvement, they think about it in terms of maybe manufacturing.
Yes.
But a hospital is not an assembly line.
Correct.
Healthcare is not an assembly line. In complex clinical environments, how do you strike a balance between Lean Six Sigma's push for standardization and the need to accommodate each patient's unique needs? That's interesting.
Yeah, the thing for me is you don't have to be a clinician to understand Lean Six Sigma and do the work. You simplify the language by making models very, very simple and making the data very, very simple, because it's really about the data. If I have one widget and you have two widgets, how do we make those widgets work together? And you make it, to me, just break it down simply into simple terms. And then you just have to me, again, you tell that story again to make sure someone understands that, yes, manufacturing does this to look at a widget, but I'm looking at data as this because a patient, technically, not the patient itself, but the processes for a patient to go from emergency room to admissions to different levels, to be discharged, to get outcomes, all that is data. And you take the data and really it's about the models. The models we have in Lean Six Sigma and performance improvement really can go for any aspect of any area of your life, whether it's manufacturing, whether it's accounting, no matter what the field is, you can apply these principles and get great outcomes if you understand the models. And we try to make the models simple so you can, especially with the entry-level processes that we do, and that's how we get you started. And once you go through it 1 or 2 times, I guarantee you, I believe you'll be hooked.
And I'm so glad that Mike used the word widget, because if I have heard once, I have heard it 100 times. Patients are not widgets from the clinicians on the floors. And yet the processes that provide patients care actually comprise widgets, right? And so
Correct.
part of what we have to do when we are teaching them and showing them a new process is to get them accustomed to standardized care that they are so familiar with in all their training. So if I come in, for example, with a heart attack, people will treat me the same at every hospital I go to in the country, right? There's no variation from the process that's used. And yet, if we start talking about performance improvement and Lean Six Sigma, people get a little nervous, like as if we are going to not allow them any freedom of thought. But that's not our goal. Our goal is to standardize the parts that can be standardized and respect the parts that are individual for a patient or for a clinician.
Yes. I think you both made excellent points there, because I'm not a widget, definitely. But if I'm waiting too long for an MRI, I want people looking at the process to get me in there faster.
That's right.
Exactly. You just did it. There you go. There you go.
Did I just do informatics?
Yes, you did. Yes.
Fantastic. Oh man, that's great. Hey, from a high reliability organization standpoint, how do you integrate patient safety science with Lean Six Sigma to proactively spot and mitigate systemic risks?
So
I sounded real smart asking that question just now, by the way.
Mike, are you okay if I go first on this one? So
sure, please.
Thanks, Mike. So it's really interesting, Dan, that you brought that up, because for the past probably 10, 15 years, my focus on teaching has been about high reliability. So I rolled high reliability out across the state of Connecticut, but the predecessor to high reliability in many ways was understanding how Lean Six Sigma operated, right? Operational excellence is part and parcel of high reliability. You can't have high reliability unless you are first looking at the processes and determining where the variation is, where the waste is, where you can standardize those processes. So they all fit together so nicely. And I know that healthcare organizations right now want to be highly reliable organizations. And an easy way to get at that is to roll out performance improvement processes that are Lean Six Sigma processes. Mike, you want to add to that?
Yeah, great comment though, Mary. But I want to say we treat safety like a system, not a checklist. So we use Lean Six Sigma tools like root cause analysis, control charts, and processing maps. and we layer in safety science principles, as like say something like an FMEA. And then we constantly asking, where could this breakdown come? Who's the closest to the risk? And how do we build resilience in this process? It's proactive, not reactive. And think of it as designing for safety, not just inspecting it. And that's, to me, you put those things together and you're looking for systemic risk to mitigate those.
FMEA is, of course, failure mode and effects analysis. And after a particularly thorough FMEA, I have found no failures with this short break. MoreSteam's enterprise process improvement platform includes the tools, training, and software you need to transform your organization into a problem-solving powerhouse. Join the ranks of Fortune 500 companies that trust MoreSteam for their enterprise process improvement. Visit MoreSteam.com to learn more. And now back to my conversation with Mary Wright Cooper and Michael Anderson. You have such a great program there at Thomas Jefferson University. What advice would you give other healthcare organizations that are just beginning their journeys into Lean Six Sigma or operational excellence? Obviously, you've had some experience with this. You've had some things that worked. You've had some things that don't work. That's continuous improvement. So what are some advice that you'd give to other healthcare organizations?
I think that the best piece of advice I got when I first started doing this was don't be afraid of failure. That failure is just an opportunity for us to learn. And healthcare organizations right now have so many external demands. They have a workforce that has been traumatized by the pandemic and by a staff exodus as a result of the pandemic, that they are not really open to the idea of failure because they're afraid that the repercussions are going to be so great. But only through rolling out processes that challenge the way we've always done things are we going to improve healthcare delivery. And only by acknowledging the fact that sometimes when we do it, it's just not going to work for whatever reason. Federal rules change just as we're rolling something out. Or alternatively, our patient mix changes. Or alternatively, we have a new person who comes in from another organization and teaches us something new yet again. But there is this sense among leaders right now that they have to get it right the first time. And I would just caution them about being wedded to that. What I think they have to do is they just have to try. They just have to try and try and try. Things will stick. If they're right for the organization, they will stick.
Yeah. And to add to that, Mary, I would think that organizations, and particularly in leadership, have to look at these models as value add. I think a lot of time they look at it as a checkbox. They'll get a project in, like Mary said, they'll get it done, and it's not sustainable. It's not repeatable. It's not measurable. They just get it in, and it's a checkbox, and it's done. And then also when we have great resources that know these processes and they turn over or go to other organizations, we don't replace them. We just get something income that's very standard to keep the process moving, but not really growing. And I just don't think that a lot of leadership is taking these processes seriously enough and putting enough dollars and time into them to make them valuable for the organizations.
Mary, you just mentioned something about staff and the challenges dealing with staff, especially in a post-pandemic world. We recently had guests on the show from Dartmouth Health, and they talked about using Lean Six Sigma to help eliminate burnout among staff and using process improvement in that manner. Could you speak to that? Because I found that to be fascinating.
So I am so glad you brought that up, Dan, because for me, performance improvement and process improvement and Lean Six Sigma are the antidotes to burnout. I 100% agree with the folks from Dartmouth Hitchcock. If you as an individual think that you don't have any control over your environment or your life, or especially your work life, at some point you start to disengage because it's overwhelming. And so what happens in the situations where there are opportunities to change what's around us, whether it is starting a new process, whether it's refining a process, whether it's looking at different outcomes, we start to get engaged again. And once we start to get engaged, we see that it's actually possible to change the world around us. And I feel as passionately about healthcare delivery now as I did when I first started out. And so much of that is due to my work in operational excellence because I always feel like I can step back, look at a process, look at the way patients get care, and I can change it. If it's not working for them, if it's not working for me, I can change it. And so that has been a real motivator for me. And I think it works for everybody in terms of burnout.
Excellent. Thank you so much for that. This is some fascinating stuff because it's stuff I hadn't necessarily thought about when I started interviewing people in the healthcare space. So I'm really learning a lot from this. So thank you so much. How have you woven Lean Six Sigma and continuous improvement principles into the curriculum at Jefferson College of Population Health?
Mike, you want to take that?
Sure. I think we've done a really good job at embedding it right into the DNA of our program, from our master's program to just everything we're working on. So it's been really great. And students just don't learn the theory, they actually apply it. We've got real world projects, simulations, and even Lean Six Sigma Greenbelt pathway that has just been great and is growing extensively, having great partners like yourself. So, and we're emphasizing system thinking, how population health, equity, and operations all intersect. And then because of that, let's face it, if we want to fix healthcare, we need for leaders to not think like designers and act like engineers and act like just be humans and try to fix processes.
And the other thing I think that contributes to it is that we have a faculty who really have embraced operational excellence. A bunch of them who have green belts or black belts or master black belt. And by recruiting those kind of folks, they have really ensured that our commitment to operational excellence is grounded in process improvement in a way that is, we don't just talk about it, we demonstrate how to do it. And I think the students really appreciate that.
Agreed.
We mentioned earlier that patients aren't widgets, which is something you've heard many times. But is there one thing that healthcare could learn from industries that maybe have more mature lean practices like technology or manufacturing? Is there one thing that healthcare could learn more from those industries?
I think more than one thing. If you think about it, the Lean Six Sigma starts with the Toyota process. And if you think about a car manufacturer, each area is building one section of the model until it gets to a final end. So think about the patient they come in our door, they come into the garage, they come into the waiting room, then they go into a practice or they go into a service. It's the same process of following a process and making sure that the process is the most efficient as possible. And Lean Six Sigma is the highest form of efficiency. So that's what you want to get it to. You want to make sure our patients are flowing through our system. If you take the patient out and you don't call it a widget, the process still moves the same way. Each of my processes have to be efficient and very coupled for that patient till they come back to my facility, and also spread the word to have great customer satisfaction.
Although Mike's example does point out one opportunity that we have in healthcare that I just don't think we do very well, and that's handoffs. So in Mike's example, you can't have different sections of a car being built and have it turn out as a car unless there are good handoffs from section to section. We do not do that well in healthcare. And part of that has been because we are person-centered, right? Rather than process-centered, we're person-centered. So we're ensuring that that individual leaves the environment, whether it's the ambulatory practice to go to the pharmacy, whether it's the hospital to go to a subacute facility, but regardless of what it is, we're looking at it from that individual perspective. And we really need to look at that much more systematically to ensure that people get what they need when they go to the next section. We've tried all sorts of things to make that improve over the past 20 years, but we are not there yet. We still have terrible handoffs.
You say 20 years, Mary, I say 100. And the reason why I say that, when I first even got to Penn and I met doctors who were well in their retirement ages, they looked at me like I was crazy when I was so excited about doing all of these projects for performance improvement. It says, Mike, we worked on this stuff 25, 30 years ago before you even came into this world. And you're still working on it. And you're right. We're working on the same issues. The same exact issues that we did 100 years ago, we're working on those issues today.
Yes, it's true.
We talked a lot about handoffs in a previous episode of the show with Ryan Weiss. So I encourage listeners to go back and listen to that episode to learn more about the concept of handoffs, like a handoff to Saquon Barkley. And before we go looking into the future, I'm going to look into the past because it's always exciting for me. I was actually born in Philadelphia. I'm going to have to go back and look at my birth certificate to know if I was born at your facility or not, but I was born in Philadelphia. Recently, we had a guest on the show who worked at Pizza Hut. I was able to share that I met my wife working at Pizza Hut.
Oh, there
I
you
was
go.
born in Philadelphia. So this is very, very exciting. That's my looking back. Now I'm looking forward with cutting edge trends like AI-driven process optimization or lean digital transformation. Among those trends, what do you think will redefine operational excellence in healthcare looking forward?
Okay, Mike, with the informatics background, you go first.
Tell me a story.
I'll start. I believe we're on the edge of something extremely big. AI is going to supercharge process improvement. Imagine like real-time bottleneck detection, predictive staffing, predictive analysis, and even AI co-pilots for clinical workflows. All these things they're not coming. They're actually here. And the real game changer is lean digital transformation. It's not just slapping tech onto the top of a broken process. It's rethinking the whole system with digital processes in mind. And when you combine that with human-centered design, that's where the magic is going to happen. But we are on the edge. AI, stop thinking that AI is coming. It's actually here, and we better embrace it, because if we don't, we're going to lose a big opportunity.
And I do think, it's no different than other process improvement approaches we've taken over the past, in Mike's words, the past 100 years and stuff. The part that gets in the way is what we as humans fear about the unknown, right? We fear change. We fear something different. And to Mike's point, no reason to fear this. We need to embrace it and adapt it to what we are doing so that it can, in turn, adapt the process to an improved outcome for our patients.
Thank you so much. This has been such a fantastic conversation. I have learned a lot. I believe our listeners will have learned a lot. And I'm going to drop one more reference to the Eagles. I want to thank Mary Reich Cooper and Mike Anderson for this podcast's own Philly special. So I appreciate you being here. This has been great. Before we end the show, is there anything else you'd like to share with our listeners? Anything we haven't touched on yet?
No, can I just point out that although I'm a Philly person, that my mom was born in Ohio.
Oh, really?
You are the Ohio State University. My mom was born in Ohio. All my cousins live in Ohio. So in some ways,
Where?
I'm an Ohioan as well.
Fantastic.
My mom was born and raised in Barberton, right outside of Akron.
Oh,
And
yeah.
all my cousins live in the Akron, Cleveland area. Yeah.
Well, fantastic. That's great.
So yeah. So I have a little bit of Ohio in me as well.
Right on. Well, we love having another really smart, well-credentialed person that we can claim for Ohio. So awesome. Mike, anything you'd like to add?
Well, yeah, just that I think that if you're interested in performance improvement, Lean Six Sigma, those processes, operational excellence, take a stab at it, because you'll find out that it's not just beneficial for your for your business life. It is 1000% will be beneficial for your personal life as well. Your mindset will change in how you think about things, not just in business, but all throughout your career and your life. So that would be my suggestion, is take a stab at it and see if you like it.
Awesome. That is great advice. And Mike, where are you from originally? We're sharing here.
Born and raised in Philadelphia all my life. So I'm Philadelphian all the way. Home of the Eagles.
Fantastic. Home of the Eagles, home of the Sixers. My
Phillies,
favorite basketball
Flyers,
player growing up
Sixers.
was Dr. J. Absolutely.
Yeah.
Excellent. Mary, Mike, thank you so much. I truly appreciate you being here. This has been a really fun conversation. And I look forward to talking with you again, because I've learned a lot. And this has just been great. Thank you.
Dan, thanks for having us. We really appreciate it.
Yes.
Thank you.
And thank you for listening to Quality Time with MoreSteam. You can email the show at qualitytime@moresteam.com. And if you enjoyed the show, please leave a rating or review on your favorite podcast service. Also, please go ahead and visit our website, moresteam.com, to learn about the software and tools that can help you solve problems, eliminate waste, and do things better. We'll be back in 2 weeks with more Quality Time with MoreSteam. Thanks again.